Hello, my name is Kaylee Ragland. The goal of my integrated practice project was to design a handout listing best evidence disease management options for patients with a history of diabetes who are in the critical care unit. This will provide them with the tools they need to properly manage their diabetes once they return home. I provided the information handouts to 5 patients before July 23rd to promote involvement of patients in their own care. Patients received information about how to properly manage their diabetes at home, such as proper management of blood sugar, appropriate diet, skin care, and exercise. The effectiveness of the material provided to the patients was measured by pre- and post-testing before and after the education was provided. I completed the objectives for this assignment by following the quality and safety education and nursing-based competencies. By the end of Module 1, I found 3 current evidence-based practice diabetic education resources and presented the project proposal to the nurse manager in the critical care unit where I work. The second objective for this module was to present diabetes management options and plans for when they are discharged from the hospital to patients and use informatics to design a handout and seek approval to distribute it. By the end of Module 2, I obtained information regarding diabetes management and used informatics to design a handout. I used pre- and post-testing to measure the patient's understanding of their disease before and after the education was presented. By Module 3, I began discussing the handout with patients who showed an interest in learning and discussed the options for their future diabetes management while they are in the hospital and what will happen once they are discharged. By Module 4, I continued to provide educational handouts to the patients for information prior to seeing the physician so they can ask any possible questions they might have for their doctor. I will give these educational handouts to a total of at least 5 patients who are interested in learning while they are in critical care unit. By Module 5, I worked to improve the quality of care of our critical care unit by promoting patient involvement in their own care. Hopefully, this will also decrease the rate of readmission if patients are properly managing their diabetes at home. By Module 6, I analyzed the patient responses and shared the information with my nurse manager and with the class as de-identified information to protect patient privacy. When journaling for this project, I met the objective for Module 1 when I discussed my project with the nurse manager in the critical care unit where I work the first week of class. Together, we approached the leader of the hospitalists. He thought an educational handout given to the patients was a good idea because so many of our diabetic patients are non-compliant, possibly because they are just unaware of the consequences. The references that I will start with I found in the Ottenheimer Library. I set a SMART goal for my project that was measurable, attainable, relative, and set within a specific time frame. I completed the Module 2 objective by revising my topic after discussing the issue with my instructor and nurse manager. I researched new evidence-based resources and revised my IPP Agreement. I felt like my new topic is something that is more easily taught to the patients and will help a lot of people. So many of the patients that I care for are non-compliant diabetics, but when I actually take the time to discuss the issue with them, I usually find that they are just not very educated about the issue. This week I revised my reference list to assure that all of my references were evidence-based scientific research. I used references from the Centers for Disease Control, the National Institute of Diabetes and Digestive and Kidney Diseases, and the Elsevier Interactive Patient Education site. I used these references to gather information to include in my teaching handout that I provided to diabetic patients admitted to the critical care unit. My handout included information educating patients on how to properly manage their diabetes by explaining proper blood sugar management, appropriate diet, skin care, and exercise. The overall goal of the project is to better educate diabetic patients on self-care and aim to reduce the readmission rate of patients by improving their self-care management of their disease. Module 3, I presented my educational information to the diabetic patients in the critical care unit. Before educating them, I performed the pre-test, and after educating them, I provided the post-test to assess their new level of understanding of their disease. I had 3 patients participate this week. Module 4, I continued to educate patients as well as providing a pre- and post-test. I had 2 patients participate this week. The quality improvement results were also measured during the end of this week. After evaluating these tests, I discovered that patients' level of knowledge improved from before the teaching occurred. One question was rated on a 1 to 10 scale, and it assessed the patient's current knowledge on their diabetic illness. The second question was fill in the blank and asked for symptom of both hypo and hyperglycemia. I reflected back on the implementation and execution of my integrated practice project. This assignment helped to increase my knowledge of evidence-based practice by building on research tactics that I learned in the past from other courses. This course helped me to build on the teaching and evaluation of the teaching that we have been learning throughout the BSN program. I educated patients about their diabetes and then evaluated my performance and effectiveness as an educator. Hopefully, with the information I provided, these patients will be discharged home with a new sense of self-awareness regarding their disease and the tools needed to manage it properly. Module 6, I was able to meet my objectives and the journal, the weekly interventions that helped me achieve these goals. I presented the responses to the pre- and post-test that I submitted to my patients. I also submitted a project video to my fellow peers so they can easily understand my project and all that it entailed. My integrated practice project promoted civic engagement by providing education to patients about how to properly manage their diabetes on their own at home to help promote improved overall wellness. This project was the final one of many projects that I've completed in this program, and it has made me better able to serve my patients and my community. Thank you.